6-year-old Bright had come with his aunt for follow-up checks at the oncology daycare unit following a removal of one of his kidneys. In 2019, he was diagnosed with Wilms tumor, a cancer that attacks the kidney.
I went to some human house, but then I was not wearing dress. Then they did, and then the woman saw it. Then they say, then he called my father. Then my father come and saw it. Then they say we should go to Tama. We come to Tama. They say they can't treat us. Then they send us to here.
Shortly after he was referred to the Kolebu Teaching Hospital, his father died, and his mother abandoned him in the care of his auntie, Blessing.
We were there when we realized that one side of the abdomen, the left part, it was like a boil on it. And my mom and dad decided it's just for herbal treatment, local treatment. And they sent him to the herbal. When they sent him, he was there. They've tried their best, but it couldn't work. When he returned back home, if he's going to urinate, you see that it's blood. That was the time my mom and my dad decided that where it has gotten to, it's not for just local treatment. They have to go for medical to check and see what is going on. When we got here, we followed the procedure. They started the treatment. Everything, it was fine. We went through the surgery. It was fine. We went for radiotherapy, or it was okay. And we finished our treatment. That was on last year, December.
Bright is among 1,200 children who develop the condition in Ghana every year. At the oncology department, another child, 13-year-old Gabriel, is battling leukemia. In a matter of a year, he had undergone several tests, chemotherapy, and dropped out of school.
They do operation on my ear, and they took the thing some. They took him to pathology. Then they tested. They started giving me the medicine. Then the thing gone. They say that if I finish the treatment before I'll go to school again. Yes.
When you don't go to school, how does it make you feel?
It's paining me. I feel like I should go to school.
6 weeks after Abna Nyamiche delivered Adepa, she noticed her eyes were jaundiced and quickly sought medical care. Adepa was later diagnosed with retinoblastoma, a cancer of the eye. At 6 weeks, I realized she had something yellowish on her left eye, and so I brought her quickly to Kolebu. It was there that she was diagnosed of eye cancer. She had her first surgery at 2.5 months old. Now, her left eye has been removed and she's okay.
And I'm here surgery. Yeah, surgery now 2.5 months. The only reason we're able to treat the majority of these patients is purely based on benevolence of organizations.
Dr. Lily Gloria Tego is training to become a pediatric oncologist. She tells me that treating childhood cancers is very expensive.
So it depends on the type of cancer and the stage of the cancer. So for some of our cancers, you may need as little as maybe 2,500, and for another, yeah, I'm saying little in relative terms to what I'm going to say next. For another, you may need as much as 40,000.
Lack of funds forced more than 50% of sufferers to abandon treatment midway. Lifeline for Childhood Cancers, Ghana, is one of many benevolent organizations supporting families with treatment. They fund treatment and medication to hundreds of children, including Adepa, Bright, and Gabriel. Ekuya Sapong is executive secretary.
And the last thing any woman, any mother thinks about is that my child has cancer, so I need to escalate it. So it's mainly because of that we get the very late cases. And so for Lifeline, we do a lot of awareness creation, speaking to the general public, anybody who would listen, on understanding and identifying the early warning cases. We also do advocacy. So currently, childhood cancer is not covered under the National Health Insurance. I think you may be aware breast cancer is, cervical cancer is, but as of 2021, it's not covered under childhood, under national health insurance. So we do a lot of advocacy. We help families find, provide access to treatment so they would get the best care. Yes. Apart from that, we also support the families with living costs, food, everything that they need, emotional support, financial support, a lot of it.
The foundation also provides some form of classes for patients who have had to drop out of school.
I'm always here being with these children, interacting with them, teaching them how to read and write, and also doing a lot of things like art and craft, yes. I'm using my arts as a form of therapy to be with these children. Oh, some are from 2 years to 14 years. Yeah, very exciting because they are happy, and I'm also happy with them, being with them.
Despite persistent resource constraints, health workers at Kolebu and organizations like Lifeline go out of their way to ensure that their young patients receive optimum care and win the fight against cancer. Mamiesi Thompson for Joy News.